evening and welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Authority and the health insurance space at large. In this episode, we will continue to bring you more insight into GIFSHIP N as a program under the National Health Insurance Authority that provides health insurance for core members all through their service year. And in our stakeholders segment, we spoke with the CMD of Itunu Hospital in Abeokuta, Ogun State. He spoke on health insurance in Nigeria, as well as its partnership with the National Health Insurance Authority towards attaining universal health coverage. I am Aisha Muhammad Ahmad, your regular anchor, urging you to stay tuned for the full package coming your way after the break.
GIFSHIP moves, leaving no one behind. GIFSHIP moves, leaving no one behind. GIFSHIP moves, leaving no one behind. GIFSHIP moves, leaving no one behind.
First on the program is a highlight of events around the NHIA. In the news, NHIA trains program officers on formal sector business process, just as Cross River distributes health insurance cards to civil servants. These and more stories coming your way.
A workshop on formal sector business process was organized by the National Health Insurance Authority for program officers in the Northwest Zone. The essence of the workshop was to create uniformity and synergy in the NHIA, both at the headquarters as well as state offices of the NHIA. Other objectives of the workshop were to educate officers on how to register beneficiaries into different NHIA programs, what to look out for when doing a fresh registration, as well as how to add extra dependents, among other things. The workshop started with a presentation on the responsibility of the state offices.
It's your responsibility as a state office to carry out new registration, or what we call fresh registration, for formal civil service, federal civil service, OPS, and all categories of GIFSHIP. Renewal of all the programs as well, additional dependents, extra dependents, change of healthcare facility. I'm coming to this removal and deactivation again, and then change of employer. These are actually the functions of the state offices.
It was interactive, with other papers touching on relevant subheads in the various business processes.
Business processes and the day-to-day.
At the end of the workshop, participants speak on the impact of the training.
So it is a very good initiative because a lot of gray areas have been solved, a lot of questions have been raised and answers were given. So we have been given clarifications to so many things that we were not aware of. There have been some certain reviews that were not properly communicated to us, or you tend to see a lot of discrepancies or a problem with miscommunication. So, but this kind of training avail us, to hear from the horse's mouth, thereby getting consistency regarding our operations within the whole atmosphere of the programs department.
Overall essence of the training is to bring back our knowledge of what we have been doing in the state offices to accelerate the drive toward the achievement of universal health care coverage in the country. And I think this is a good move, a good initiative by the management towards reminding staff of their basic schedule of duties on what they are supposed to do, so that there will be a kind of good synergy and the collaboration between state offices and the headquarters and NHIA headquarters at large.
The Cross River State Government has distributed identity cards to public and civil servants registered under the State Health Insurance Scheme. The ID cards are to facilitate access to affordable medical services in the state. Speaking during the presentation ceremony, The Cross River State Commissioner for Health, Dr. Janet Ekpenyo, said that the health insurance policy introduced in the state was essential to achieve universal health coverage and strengthen the sector, as it will see to the employment of more doctors, nurses, as well as expand infrastructure in the health sector. Also speaking during the event, the Director General, Cross River State Health Insurance Agency, Sir Godwin Yala, said that insurance translates to savings for the government workforce because the monthly insurance cost of 1,000 naira was affordable. Yala explained that to make healthcare accessible, 36 secondary medical facilities have been selected for the implementation of the scheme across the 18 council areas, and the facilities are ready to offer quality accessible healthcare to the people of Cross River State.
Welcome back. Recall that in a previous episode, we talked about the GIFSHIP end product and its gains to core members during their National Youth Service Year. The scheme is not automatic, as core members also have a role to play for the scheme to run as it should. Dr. A.K. Jonathan sheds light on these, even as we look at other areas of GIFSHIP N. Don't go away.
In February 2022, GIFSHIP N was officially flagged off for members of the National Youth Service Corps, NYSC. Speaking at the ceremony, Professor Nasir Sambo, the Director General of the NHIA, said the program will bring succor to core members. He also said quite a lot has been put in place to develop a framework to enable a seamless program.
A lot of work has undertaken in the areas of developing the framework that will enable the National Insurance Scheme and the NYSC to administer this program seamlessly. We have been moving from a pillar to post to the Federal Ministry of Finance, and finally we were able in 2021 to get the approval and inclusion of the funding for the NYSC coverage. And the funding of this coverage was granted in August 2021, and we continue to move to ensure that we have a credible system that will navigate this program. And I'm happy today we are here to witness the flag off of the program.
At the formal flag off, core members expressed joy over the initiative.
When I started serving for 2 weeks, during my course of service, I was home with fever, as I couldn't go to my place of primary assignment, and it affected productivity in the way in the company because I have a key role I play. I think with a scheme like this, that has been taken care of. If I fall sick, instead of going to buy the normal malaria drugs, every person buys, when you fall sick in Nigeria, it's either malaria or typhoid. You don't go to do tests or all those stuff. But with a scheme like this, I think productivity has been enhanced very well in the NYSC.
I think it's a good start that they started it now. The corpers are getting involved, and it's going to be a good start for them. I want to thank the DG for making this possible for the corpers to get involved in it, and it's going to go a long way.
1 year later, core members are still lauding this initiative that has given them easy access to qualitative healthcare at no cost. One good thing with GIFSHIP N is that it is fully funded by the federal government. Its sustainability is therefore guaranteed.
Core members are wholly properties of the federal government. So they are children of the federal government. So the federal government is taking care of them. In fact, they only received the first tranche payment. The second tranche payment we have written, we hope that they are going to release it, right? So, and we have carried out a lot of advocacies to see that the funding is released for us to continue. But I know that the federal government has started it, which is one of the great achievements of our current President Buhari, President Muhammad Buhari. There are certain things we wonder. President Muhammad Buhari A lot of people do not know. In fact, if you give me, I'll call him the father of universal health coverage in Nigeria. Because not just the law he signed the other day, not just because of the NYSC program. President Muhammad Buhari, even as a military head of state, was in his tenure. Not even the work that set up NHIA started. But a lot of people do not know. So, that is part of the accolades we're going to him. And I know that with him, they're not going to stop releasing these funds.
Omotade Folorunsho, Director, Core Welfare and Health Services, NYSC, speaks on how core members can access care provided under the GIFSHIP N.
Of course, NHIA generates the NHIS number and of course automatically enroll them. And depending on the geopolitical zone, they are assigned automatically to HMOs and of course the healthcare providers. So depending on where you are, when you are sick, you are expected to present yourself at the hospital, the healthcare provider, and of course, depending on the issue, the type of ailment too. But it is almost automatic that when you present yourself with your NHIS number, which is also present on the NYSC ID card, so you can access care at any time, anything.
Healthcare under GIFSHIP N terminates at the end of the service year. How does this contribute to or affect the attainment of universal health coverage? Dr. Eke explains further.
With what we are doing with this program, it is part of, whether it indirectly with NYSC, but I know that the mandate of this organization is to cover every Nigerian. And if in a year we are taking care of 370,000 people, NYSC core members, that is an addition to our mission to attain universal health coverage. So that is it. A lot of them are already, in fact, they're even advocates because they already know about health insurance. When you left the university, did you know anything about health insurance? Even before you came into contact with NHIA, did you know anything about it? Even there are a lot of people who don't even know about those who did their service before this thing came. Even if when you employ them and give them job, you will see them every day here. But with this, we already, if you can harness the core members and use them as advocacy tools, it's going to do a lot.
GIFSHIP N is a part of the vision of the NHIA to ensure that every Nigerian is included in the healthcare delivery plan of the federal government. As an initiative under the NHIA, it has had a lot of impact.
Now, of course, far exceeds that. I was with the other day, the director core welfare, and they said, yeah, and they're very impressed with what, one, it's even solved a lot of problems for them. How to take this, how to handle this. Two, even the core members, all of them, you have a sense, that feeling that I have this protection. You understand? Yeah. So you don't need to even begin to go around, scatter, running everywhere. I have this condition. Now, once you have a need for healthcare, once you get to the facility and trigger them, you get your service.
The impact of the program is not only felt by the leadership of the NYSC, but even officers in the states and zones who interface directly and supervise the day-to-day activities of the core members.
On the part of NYSC and also the managers of NYSC at the state level, I was once a state coordinator of NYSC in Delta State. I knew what it was. We are all parents. We are human beings. When you hear that your core member is sick or something untoward is happening to that core member, sincerely speaking, you don't have the rest of mind until that core member is able to get the necessary solution. So the issue of is coming today, is coming tomorrow by way of hues and cries that normally associate with head of core members, I think that has reduced considerably. And the players, the managers at that level of administration of NYSC, they are having a better rest of mind than it used to be.
However, core members have a responsibility in making the GIFSHIP N function effectively for the benefit of themselves and the nation.
The first thing we need to do is there's this thing they create within the comments, so let them be the vanguard of the program. Not just the vanguard for the program, they equally be an advocate for the broader health insurance issue. Two, if they have any need, first of all, they'll go to the hospital. What we see, in fact, there was even one that went to the social media. I had to call and start asking her question. And what she eventually said was not really what you understand. But for me, it is, I'm not somebody that likes you to cover to cover death. I want you to blot it out complete. I don't believe in, if you have that problem, say it. Let's deal with it. Understand? For a lot of you, you know me, I don't do like this. I will tell you the truth.
The NYSC GIFSHIP program is designed to cover pre-orientation, orientation, primary assignment, and terminal leave periods of the service year of core members and will terminate at the end of the service year.
Our stakeholder this week is Dr. Akolawole Ajayi. He is the proprietor and medical director of Itunu Hospital, Abeokuta, one of the healthcare providers under the National Health Insurance Authority, NHIA. The facility has about 700 enrollees under the NHIA program and hundreds of others under the private health insurance program. He speaks on some of the efforts of the facility in meeting up with the needs of its enrollees.
We make sure that at any point in time there is a doctor on ground. There's a doctor 24 hours of the day. Then we make sure that we have adequate supply of drugs. If you interview some of the enrollees who come here, they'll tell you that this is one hospital that we rarely write out drugs for them to go and buy, except drugs that are not on the list and the HMO has not given us approval to give. Then as a good laboratory backup to take care of, it's a primary care center. But some of the private HMOs use us for secondary care. We have consultants in some of the specialties, surgery, ORG, pediatrics, even mental health for those who require them.
Dr. Ajayi speaks on the new National Health Insurance Authority Act, which makes health insurance mandatory for all Nigerians.
To some of us who actually believe in this scheme, it was a drawback. Maybe along the line, I'll share a personal experience with you. So it was a drawback. But I think, overall, it's a good thing if we properly implement it. I think it's good for the average Nigerian on the street because particularly with the downturn in the economy, it's really very difficult for people to come to hospital and pay out of pocket. Most of the people who actually very free to come are the easiest or the smallest complaints. They are usually the people who have one form of insurance, health insurance scheme or the other. I think it's a plus for Nigerians. I think the only thing that we now have to really work on is a proper implementation of the Act.
According to him, Itunu Hospital is not only keying into the program, but also putting in a lot of effort to ensure that the objective of universal health coverage is achieved.
We are trying our best in our only two ways. Most of the people who come, we educate them on the benefits of the scheme. And those of them already on the scheme, we try to tell them that it's a scheme that they should actually guard jealously and not abuse so that it can be sustained. And The encouragement we give to them as well is that it's always very good. At the slightest complaints, it's always good that you come, so that at least when you come, we can handle you with, little or no serious effort. So you don't now have to wait until when the simple drugs are not going to be useful anymore, and everybody is now running all over the place looking for more expensive drugs or looking for referral to take you to some other places, which will eventually be very expensive or be a task on the system. But by and large, they come early, we encourage them to present themselves. Never mind, any little thing, just come, you're entitled to it.
While Dr. Akolawole Ajayi agrees that much still needs to be done, the NHIA has actually come a long way and has achieved a lot.
We are not there yet, but tremendous effort is being made to actualize the dream of the agency or the act itself. Because if you look around, most of the states are already having one form of health insurance agency or the other. There are so many private health maintenance organizations coming up, and they are equally getting their own pool of enrollees. And so if you look at it by and large, you discover that the percentage of engagement with the scheme is increasing on a daily basis. So I may not have the opportunity of the figures, but I think it's increasing.
On ways to improve on the health insurance program and further expand its coverage, Dr. Akolawole Ajayi has this suggestion.
Education is actually very important. We still have to continue to educate our people about the importance and the need to come on board. Most of our people still don't understand, particularly if they have to pay premiums from their pockets. And it's not because of anything, it's because of lack of trust for some of the government agencies, particularly at the state level. It's been very difficult to really get the civil servants to come on board of the state health insurance scheme.
Finally, Dr. Akolawole described a successful health insurance program as the future of medical practice in Nigeria, and that should be supported by all stakeholders.
I pray it succeeds, it continues to grow. I pray patronage continues to increase. Because at the end of the day, like I always tell some of my colleagues, I said that's the future of medical practice. A successful health insurance scheme is the future of medical practice. Otherwise, the figures, most of the parameters, the mortality rate, morbidity rate here and there will not go down. But the moment we get it right, most of those things will naturally come down and everybody will be happy for it. So on a final note, I think it's a scheme that should be encouraged to succeed, and is the future of medical practice in Nigeria.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: what is the GIFSHIP program?
It is supposed to be an all-encompassing program that will cover G group of people, I individual, and F family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
This is where we draw the curtains on this program today. Join us for another interesting episode again, same time and on this same station, as we continue to bring you more stories of happenings around the NHIA and the health insurance ecosystem at large. But if you do have inquiries or comments, send them to any of our feedback channels. Enjoy the rest of the evening.